Vertigo is the sensation that the room is spinning around you. Sometimes it's a little hard to differentiate from dizziness. Dizziness and vertigo are often used interchangeably. Dizziness, though, typically is more kind of the lightheaded sensation. When you stand up too quick, you get that head rush. You know, that's usually more of a dizzy sensation. Vertigo is the actual sensation that you're looking at the room and it's moving. It's spinning around you.
Sounds scary.
It is kind of a scary thing. And it can be triggered by a couple things. I mean, what's one thing that can trigger vertigo?
Well, one common one, the most common one, is the little otolithic crystals. These little crystals we have, they're almost like, if you really look at the consistency and how big they really are, it's almost like the consistency of sand. So they're pretty small. So we say crystals, but they're not like this big thing. They're very teeny small pebbles, and they can become dislodged or put in a place that they shouldn't be in. And when they are in a canal with fluid where they're not supposed to be, they cause the fluid to move too quickly. And so when you get up out of bed and you have this big push of fluid that happens quickly, it sends a signal that's kind of an error, like an air signal to your brain, and your brain doesn't know what to do with it, so it tries to keep up by moving your eyes, and so it causes your eyes to move quick. And when your eyeballs are doing this, your world is spinning. And so the little crystals can be a very common type of vertigo that people feel, it's just a quick, robust sensation of movement, like something's not right. And usually after about 5 to 15 seconds, it's usually pretty quick, it goes away. So that's probably the most common one.
I remember in school learning about crystals in our inner ear and thinking it sounded totally made up. You know, There's no way we've got crystals in our ear.
Rocks in my brain.
And these are not, you know, when you think of crystals, we're talking about really small things.
Yeah.
You know, probably smaller than a grain of sand.
They just call them crystals because under a microscope,
yeah,
they look
kind of like rocks.
But to the naked eye, that's pretty small stuff.
Tiny. And you know, there's lots of them in our inner ear. Sometimes I think we're picturing like one big boulder getting out of place or something. You know, there's a membrane in our inner ear that's lined with these little crystals, these otoconia. And it's more like picturing if you were to dump a little bit of sand into a jar of water. You know, these crystals loose in our inner ear is kind of like these free-floating grains of sand in water, and it does make people have vertigo. Right. Another thing that could cause vertigo could be an inner ear infection. When we get infected ears, you know, this is common with kids, right? My kids have had tons of ear infections this winter. But these are middle ear infections. A middle ear infection is an infection behind the eardrum. Very common. Really common in kids.
Associated with some pain.
Pain, it hurts.
Mom.
You can't hear real well. Yeah. Kids get tubes put in their eardrum to drain that fluid out.
Sometimes, yeah.
But these are middle ear infections. An inner ear infection is a little different, right?
Deep inner, yeah.
Way down inside. And when the inner ear gets infected, the swelling that happens, the inflammation that happens, it causes some severe vertigo.
Because it's in a bone.
Yeah,
there's no release, right?
Yeah.
Like when you scratch yourself and get infected, it can get big, like scar tissue and stuff, and then it can come back down. In the inner ear, it's encapsulated in a bone, and so that infection is like killing stuff.
It's got nowhere to go when it's inflamed and expanding. Yeah, and it actually causes permanent damage. People with inner ear infections often end up not only with vertigo, but with permanent hearing loss, which can be kind of scary.
It's interesting how you've got those World War II movies, and you have the twin props going, and the airplane is flying nicely, and then all of a sudden one of the engines goes down. I always think about individuals who have an inner ear infection. One of their props has just gone down, and their brain, our brain, is used to managing and using input from both sides, information from both sides. So when one side shuts down, your brain and your ear and your eye are trying to figure it out. And just like in World War II and some of these planes, you see these videos of these airplanes doing a tailspin. That's what vertigo is we go into a tailspin because one of our props just shut down. Yeah. So kind of an interesting one. Yeah. So besides the inner ear infections and the little crystals being loose, common things that we see that can cause vertigo and cause people to feel really off would be blood pressure issues. Most notably, way too high, and the most common, way too low. People with hypotension or low blood pressure, they do have these common side effects of positioning induced dizziness or feelings of disorientation.
And one good thing to know about that, you know, we're not primary care physicians. We're not cardiologists. We deal with the ear, right? We're specialists of the inner ear. But we have really good relationships with most of the doctors around town. And so if we suspect that there's something that's at play here, maybe a blood pressure issue, we work closely with a lot of these primary care doctors, and we're happy to communicate with them.
We're a big fan of the team approach, for sure. We're a big team, big medical team in this city. And I do really appreciate that point, because how awesome are the physicians in town? They do a really great job. They're listening. They're trying to figure out, what could this be, the ear? Is this just a neurologic issue, or is it a blood pressure issue? And so they're kind of the gatekeeper, and they do a really good job. I'm always surprised at the quality of patients they send. They seem to know exactly who to send to get this information and maybe get results and further knowledge about what could my patient be experiencing. And so it's a big shout out to our family docs, our internists, our neurologists, the cardiology team, the physical therapy team. I'm just naming all the. We really work with a lot of different types of specialties to make sure that our patients are getting the right information. So
yeah, we've worked hard to develop relationships with all these doctors and communicate professionally with them and help our patients the best we can.